We are going to talk about movement terms, so different words to describe different movements that your patient might be doing. Some of these you might know already, but in case you haven't thought about them this way or what their actual definition is, we're going to go through all of them, okay? First set, we're going to talk about our flexion and extension. Now the definition of flexion and extension, they're kind of weird. The definition of extension is moving the two bones that make up the joint, moving them away from each other. Okay, so if we're looking at the elbow, here's my elbow joint. So my humerus and my ulna is what make up my elbow joint. Okay, now if these two bones move further away from each other, that would be extension of the elbow. If these two bones move closer together, that would be flexion. Okay, but it gets a little weird, like look at your neck, okay? Your neck, your cervical vertebrae, well, they all connect to each other, and then there's the head on top. And which way are things getting closer together, and which direction are things getting further apart? So let me give you a little bit easier way to think of this. Flexion is bending, extension is straightening, and for every joint except for the knee, flexion is forward. So movement in a forward direction. So flexion of my neck, my head goes forward. Flexion of my hip, my leg goes forward. Flexion of my elbow, my arm goes forward. Again, the knee is backwards, but again, go back to bending and straightening. Flexion is bending. So my knee, if I bend it, I bend my knee. Yes, my foot goes backwards. It's the one exception to the forward rule, but hopefully that helps. Okay. You can also have lateral flexion. We don't really ever use the word lateral extension, but lateral flexion is just bending sideways. So if I was going to laterally flex my neck, I would do that. To laterally flex my trunk, I would bend sideways. Okay. Abduction and adduction. Sometimes we say abduction for abduction and adduction for adduction. We're going to go back to that concept of the midline. Handwriting is terrible. Midline, that line that goes straight down the middle of your body. If you have a joint adduct, so let's say I'm standing like this, and I want to adduct my shoulder, I'm going to add it into my body. I'm going to bring the body part closer to this midline. That is adduction. To abduct, I bring the body part away from the midline. So this would be abduction. Abduction of my hip would be my leg going out away from this midline. Hip adduction coming in. Internal rotation, also called medial rotation, and external rotation, which is also called lateral rotation. They're used interchangeably, and I would say with equal popularity. So I personally say internal and external. So that's what I'm going to stick with, just for my own mental sanity. Internal rotation is going to be spinning the body part in towards midline, and external rotation is going to be spinning the body part away from the midline. Now, the only joints that internally and externally rotate are your shoulder and your hip. Only two in your body. Okay, they're ball and socket joints. They're the only ones that can spin like this and roll like this. Okay, but I want you to look at my arm. So my arm, my humerus, is next to my body. It's not going to move. My arm is not going to move in space at all. It's going to stay locked against my body. But I'm spinning this bone is just twisting, and my moving bone, my forearm, is going towards the midline. That would be internal rotation, okay? Or if I'm back at my starting point, and this bone is moving away from my midline, again, spinning in place, that is external rotation, okay? So look at the difference. This would be abduction of my shoulder. So I moved through space, my whole arm went away from my body, away from the midline. This would be external rotation of my shoulder, where this bone didn't move in space, it just spun, okay? Work on that one a little bit. Just the term rotation. Rotation is a term we use basically for our spine because it's already on the midline. So if I'm going to rotate my neck, I can rotate it to the right or the left. If I want to rotate my trunk, I can rotate to the right or the left. It's spinning. It's just turning that body part. But again, it's already a central body part, so it's not going towards or away from midline. Okay. Supination and pronation take place at your forearm. Actually takes place at two different joints. So easiest way to think of it is supination is palm up, like you're carrying a bowl of soup. And pronation is turning palm down, like you're pouring out the soup or you're pouring out a soda can. Okay. Supination, palm up, carrying the soup. Pronation, palm down, pouring out. Protraction and retraction, only a few parts of the body do this. Protraction is moving a body part straight anterior, and retraction is bringing it back in a posterior direction. So you can do your jaw, you can protract your jaw, and you can retract it. You can protract and retract your vertebrae, your head on your vertebrae. And you can do your shoulder blades. You can protract your scapula, and you can retract your scapula, bringing them forward and backward. Those are really the only body parts that are able to protract and retract. Radial and ulnar deviation. Here we're talking about your wrist, and the radial side of your forearm is your thumb side, and the ulnar, your ulnar bone, is going to be on the pinky side, okay, if you're in anatomic position. So radial deviation means I'm going to deviate my hand towards the radial side of my forearm. So my thumb is going to get closer to my forearm. That's radial deviation. Ulnar deviation is I'm going to deviate or move my hand toward the ulnar side of my forearm. So now my pinky side of my hand is going to get closer. So radial deviation, ulnar deviation. Circumduction, you make a circle. Okay, circumduction, circumference, circle, all sound the same. So any body part you can make a circle with. So I can do my wrists. I can do my ankles. I can circumduct. I can circumduct my shoulder. I can circumduct my head. I can circumduct my hip. Okay, all your wonderful little ball and socket joints. But that's kind of it. Horizontal abduction and adduction. So we talked about abduction and adduction already. So now all we're going to do is we're going to put the body part in a horizontal position. So the body part we're talking about is going to be parallel to the floor. And then we're going to adduct or bring that body part closer to the midline. Or we're going to abduct and bring it further away from the midline. Okay? So horizontal abduction of the shoulder, horizontal adduction of the shoulder. You can do it at the hip. Okay, again, the body part would be horizontal to the floor, and I can abduct, horizontally abduct, and horizontally adduct at my hip. Only two body parts you will see horizontal ab and adduction. Inversion and eversion happens at the ankle. For inversion, we're turning the sole of the foot in, like you're looking at the bottom of your shoe. And eversion, E for exit, E for out, or I guess exit means out. We're going to turn the sole of our foot out, away from the midline of our body. Okay, so inversion and eversion. Plantar flexion and dorsiflexion. So this is again at the ankle. Plantar flexion is what we think of as pointing the foot, or going up on your toes, or pressing on the gas pedal. Dorsiflexion is pulling your toes up, or if I told you to flex your ankle, you would probably dorsiflex, pulling your toes up into the air. And that's it for all of our movements.